Seconds can mean the difference between life and death. This video unlocks essential first aid techniques like tourniquets, chest thrusts, and splinting to keep you prepared. Dive into infection prevention, anaphylaxis response, and cooling hacks for cold emergencies. Your survival guide starts now. If someone suffers a deep leg injury while hiking, do you know how to stop arterial bleeding before help arrives? Most people instinctively use their hands, but that's not enough to stop life-threatening arterial bleeding. Step 1. Apply direct pressure with a clean cloth for 5 full minutes. Don't check, don't lift. Step 2. Use a 2 to 3 inch wide belt as a tourniquet. Tighten until the pulse below the injury disappears. Call 911 immediately. Even if bleeding stops, professional care is critical. Here's the shocking part. 80% of survival cases used improv tools like a folded sock as a temporary tourniquet. Who knew? If someone suddenly slurred their words or couldn't smile, would you know what to do? Time is brain, and you're running out. Most people just stare, but 70% of us can't even recognize stroke symptoms when we see them. Here's the fast method. First, check their face. Does one side droop? That's your red flag. Next, ask them to raise both arms. If one arm drifts down, act now. Brain cells die at 2 million per minute. Slurred speech is another warning sign. Call emergency services immediately. Clot-busting treatments work best within 3 to 4.5 hours. Here's the shocker. 1 in 4 survivors can't speak clearly for 6 months, but 80% of strokes are preventable with early action. Save this video. When seconds count, knowledge is your best first aid kit. Did you know 1 in 5 dog bites lead to infection? Here's how to stop it. Most people reach for rubbing alcohol, but it can actually delay healing and should never be used on deep wounds. Step 1. Rinse the wound under clean water for 5 full minutes to flush out bacteria. Step 2. Apply 3% hydrogen peroxide to kill surface germs, but only if the wound isn't deep. Then apply antibiotic ointment. Studies show it reduces infection risk by 40% when used properly. Call 911 if the wound is deep, bleeding heavily, or the dog's rabies status is unknown. Save this. You might need these life-saving steps sooner than you think. If someone breaks their arm during a hike, do you know what to do? One common item could save the day. Most people try rolled magazines, but they collapse under pressure. Here's the surprising alternative. Step 1. Crush a soda can flat. Its aluminum structure can support over 150 pounds when properly shaped. Step 2. Position the can along the injured limb. The ridges distribute pressure better than any makeshift alternative. 1 in 5 fractures happen outdoors where help is hours away. Immobilize first, then call 911 when possible. Improvised splints cut complications by 60%, and this soda can trick works for ankles, wrists, or legs too. Could this simple trick save your life someday? Share to spread this life-changing hack. If your infant starts choking, do you know the one thing most parents get wrong? 70% can't clear their airway properly. This outdated method, holding them head down over your shoulder, actually delays help by 30%. Step 1. Support the baby's head, then deliver 5 firm back slaps between the shoulder blades, like this. If that fails, do 5 chest thrusts. Press 100 to 120 pounds force here, like urgently dialing 911 on a phone keypad. And here's the shocker. Holding infants by the feet while doing this reduces success by 40%. After 5 cycles, call 911. 80% of choking deaths happen right in homes. Save this video. You never know when it'll save a life. If someone suddenly breaks out in hives and struggles to breathe, do you know what to do? 40 million EpiPens sit unused while 40% are used incorrectly. Most people just hold the EpiPen against their thigh, but anaphylaxis strikes within 5 minutes for 70% of sufferers. The correct technique: press 1.5 inches into the thigh at a 90-degree angle. Only 30% check their EpiPen's expiration date monthly. Here's the shocking part: the orange safety cap must be twisted off, not pulled. 20% of failures happen during this step. After administering, immediately call emergency services. But first, make sure you've saved this life-critical information. Did you know the twist-off cap design actually prevents accidental activation? You never know when this could save a life. If someone collapses in the heat with a red face and confusion, do you know what to do? Most people try to give water, but during heat stroke, the body can't swallow safely. Step 1. Move them to shade. Every minute counts when core temperature hits 104 degrees Fahrenheit. Step 2. Spritz water on their skin and fan aggressively. This can drop temperature 1.8 degrees Fahrenheit in 10 minutes. 30,000 plus heat stroke cases happen yearly in the US. Call 911 if they don't improve quickly. Here's the shocker: at 104 degrees Fahrenheit, your body actually stops sweating, making external cooling the only way to prevent brain damage. And if you're ever in doubt, if someone is shivering uncontrollably in freezing weather, do you know what to do? Hypothermia can steal a life in under 30 minutes. Most people make this deadly mistake: rubbing snow on the skin. It actually increases blood flow to freezing areas, worsening heat loss. Step 1. Remove wet clothing immediately. Wet clothes can drop core temperature 2 degrees Fahrenheit in just 15 minutes. Step 2. Wrap in dry blankets and use body heat. Rewarming takes 30 to 45 minutes. Start by covering head, neck, and torso first. Call emergency services if the person is unconscious, unresponsive, or shivering stops. These are critical red flags. Here's the shocking truth: you can lose consciousness in under 10 minutes when body temp drops below 95 degrees Fahrenheit. Save this, you might need it someday. If someone suddenly starts seizing, do you know what to do? Moving them could actually cause injury. Most people panic and try to hold them down, but the CDC says 1 in 5 complications come from improper positioning. First, gently guide them to their side. This recovery position reduces choking risk by 80%. Next, support their head with a folded shirt. Post-seizure confusion lasts 5 to 10 minutes, stay with them. Call 911 if the seizure lasts over 5 minutes or another follows immediately. Here's the shocking part: their body stays vulnerable for 10 minutes after. Would you have known? Save this life-saving info, you never know when it'll matter. Twisted your ankle hiking? Most people make this mistake. What if you could cut swelling in half by doing one thing within the first hour? Wrong move: ignoring it or applying heat. Here's the science-backed fix: start with rest for 48 hours to prevent further damage. Next, ice for 20 minutes every 2 to 3 hours. Always use a towel barrier. Frostbite risks are real. Compression bandages should be 15 to 20% tighter than normal. Too loose? You're just wasting time. Elevate above heart level. This reduces swelling by 30% in just 30 minutes. 70% of ankle sprains could be avoided with this RICE method. Save this video, your next adventure might depend on it. If someone is bitten by a venomous snake, do you know what to do? Most people panic, and that's exactly what not to do. Panic and movement spread venom 3x faster. The worst first aid? Trying to suck out the poison or cut the wound. Here's what works: immobilize the bitten limb immediately. A 5 cm wide bandage 10 centimeters above the bite slows venom spread by 70%. Tighten the bandage every 15 minutes for 4 hours. Keep the victim still. Their body absorbs 3x less venom this way. Even 30 seconds of delay doubles venom circulation. Call emergency services immediately, don't wait for symptoms. And remember, the difference between survival and hospitalization? Staying calm. Save this, you might need it someday. What if checking someone's smile could save their life? Here's what to look for. Most people ignore subtle signs, like a 3 o'clock slant in the smile, that appear in 68% of strokes. Step 1. Ask them to smile. A real smile moves evenly. 75% of survivors had warning signs hours earlier. Step 2. Check their arms. If one feels weak or numb, that's your red flag. Only 4% get help within the golden 3-hour window. Call emergency services immediately. Acting fast doubles survival chances. Save this, you might need it someday. If someone starts choking at dinner, do you know how to save them? Every minute, 1.5 people worldwide choke to death. Here's the 5-second hack that works. Most people panic and slap the back. Wrong move. Slapping can push the blockage deeper into the airway. Step 1. Stand behind them and deliver 5 sharp back blows between the shoulder blades. Step 2. If that fails, make a fist and thrust upward into their abdomen 5 times. One hard thrust can generate 300 pounds of pressure to dislodge the blockage. If they're unconscious, call 911 immediately. 80% of choking deaths are preventable with this technique. The Heimlich maneuver was invented in 1974 by Dr. Henry Heimlich, after he saw a nurse save a choking man with a belly press. Save this.